Stroke remains a leading cause of adult disability in the United States, with approximately 800,000 people suffering from a stroke each year. Stroke can cause major deficits in the motor system, and unfortunately, 1/3 of stroke survivors receive only a poor functional outcome even 5 years after experiencing a stroke. Upper limb impairment is one of the most common effects of stroke, and arm function is found to be altered in 73 to 88% of first-time stroke survivors. Typical symptoms include muscle weakness, incorrect timing of movement patterns, and loss of interjoint coordination. All things I'm sure you can imagine have a very large impact on activities of daily living. As with almost all facets of medicine, treatment for stroke survivors has advanced significantly. It has recently been shown that repetitive movements are one of the most effective approaches to restoring arm function post-stroke. However, this makes stroke recovery a very labor-intensive process for healthcare professionals. With this information in hand, many researchers have turned to examining the effects of robot-assisted therapy on upper extremity impairments. Imagine a tool that can provide repetitive, task-specific treatment and can also be programmed to assist on a when-needed basis to allow learning to occur. Now pair this with the recent advancements in virtual reality. You're left with a powerful tool that's changing the rehabilitative world. Robot-assisted therapy provides high-intensity, repetitive, task-specific, and interactive treatment. There have been numerous clinical trials to support the use of robot therapy post-stroke. This particular study combined robotic exoskeleton training with virtual reality and examined their effects on recovery of spatial reaching movements. Subjects took part in 3 one-hour training sessions per week for a duration of 6 weeks. Each session consisted of 3 virtual reality exercises. The first exercise consisted of reaching with aid from the robot. Subjects were asked to follow a moving spear towards a target on the screen. In the second exercise, subjects were asked to generate circular trajections. They received support for gravity until they could perform the task, at which point it was removed. Finally, they were asked to assemble 9 cubes in a virtual puzzle. The robot was programmed to provide compensation for arm weight and amplification of movement. The results showed improvement in shoulder and elbow active range of motion, a decrease in performance time, and a decrease in muscular spasticity. The results also yielded a reduction in movement irregularities, suggesting better motor control and better muscle recruitment. Interjoint coordination of shoulder and elbow also improved in the subjects. Although this study yielded powerful results, further research is needed to gain a better understanding of the observed motor performance improvements. The functional measurements in this study could not differentiate between improvements at the motor recovery level and improvements due to compensation strategies. This study clearly highlights the importance of incorporating robotic training into upper limb rehabilitative programs. With this study and many others as a benchmark, we can continue to investigate the usefulness of robots for rehab.